I'm Jay Moran.
I'm Bridget Jaipal Valenza.
I'm Thomas O'Neill White.
I'm Angelique Preston.
And I'm Lorenzo Rodriguez.
This is What's Next, a dedicated hour to have important conversations about the issues facing the marginalized and underrepresented communities of Western New York and Southern Ontario.
If we're going to have some real healing, we've got to have space to tell some uncomfortable truth.
What's Next continues our mission to discuss race,
Equity,
And the common concerns of Buffalo's East Side
And beyond.
In the suburban area, everywhere, we must work and teach our children.
And good morning, and welcome to What's Next. Today, I have the pleasure of being joined by the president of Buffalo Black Nurses here in Buffalo, Miss Tiffany Anderson. Tiffany, welcome to What's Next. How are you?
Thank you so much for having me. I'm doing great today.
This is exciting. I always like when I'm the first radio interview for my guest, and this is her first experience on radio.
Be kind.
I will do my best. I'll try not to. I'll try to pull some punches, but no. We're gonna discuss some I think some real important stuff. Nothing that's gonna come to a surprise to you, but things that might come to surprise to our listeners. Just the fact that we're still dealing with a lot of issues left over from the pandemic. We've got something that a lot of us have spoken about one way or another is just the inequities of health, the health disparities here and beyond. Tiffany, first and foremost, Buffalo Black Nurses. It's a nonprofit mostly dedicated to the promoting health and the well-being of underserved communities in the Buffalo area. I'm doing the description for you, but really, what is Buffalo Black Nurses? What is the mission?
Our mission is to promote health equity, number one, for our community, for Black and brown communities, people that look like us. A lot of people don't understand how important that is unless they're faced with a type of challenge. And unfortunately, it's not until they have a loved one or somebody that's in a hospital and they see how unfortunate mistreatment and they wish they had someone to either advocate for them or give them information to be prepared for those type of situations. So Buffalo Black Nurses, I'm going to give you a long story short, right?
Please.
It started as Black Nurses Rock. Black Nurses Rock is a national nursing organization, and Rhonda Wilson, our CEO, started the Buffalo chapter of Black Nurses Rock. And how she got it off the ground, she went to a few of her nurse friends, and she said, hey, let's do this. And so it started as an extension of that organization and had some, incremental growth over the years. And the pandemic allowed us to reevaluate ourselves. So this was in 2019. Not that we weren't making progress under Black Nurses Rock, but we had such an impact in that short period that we said, you know what? We can do this on our own and focus on our community. We don't need a national scale to do that. So the rebirth of Black Nurses Rock is now Buffalo Black Nurses Incorporated. Started with 5 friends, and we have upwards to 130 members today.
Wow. That's quite the incremental growth.
Yeah.
There. I assume that in the medical field, there's a lot of camaraderie. There's a lot of, you're in figurative trenches together. You have to be able to lean on one another. So how did that begin in the first few years of what was Black Nurses Rock and then became Buffalo Black Nurses?
Yeah.
How did that word get around? How did you start, mobilizing all these troops of nurses?
Having a presence in the community. Buffalo is a unique community. It's not a large city, but you can still live in the city and not know others. But you have to put yourself in situations that you may not necessarily be comfortable with and just having a presence. So, and I say uncomfortable because at one point in time in my life, I was shy. You could look at me now and be like, no. But
You're very outspoken. Even before the interview, we were just chatting it up. You're not a wallflower to me. So.
Yeah, so that speaks to this organization and how it can foster growth and development. So I joined the organization because I wanted to make a connection with nurses that look like myself And I was at a point in my career where I'm like, I feel kind of stagnant. And the way my brain works, I'm like always looking for like, what am I doing next? Like, what's next? What am I doing next?
Plug. Good work there by you.
So I took the initiative to go out and seek out this organization because someone mentioned it to me, and I looked it up, and I met with Rhonda one-on-one. We talked about it. I joined, and that is how my story and my journey began with this organization. So the work that we were doing, just being present in a community, starting with small fundraisers, speaking to, Buffalo loves our festivals and our events, and you have to meet people.
Half of the battle is just awareness of
Absolutely.
that. Having conversations, making sure that you're represented and that people understand you're there. So I always
it's the
say
boots on the ground.
Yes. I always say on this show we have a lot of different folks from different places promoting different things, but we're not going to solve all the problems in this room, in this 5x5 room. We're at least gonna bring a conversation to the forefront. That's been our goal with this show, and I'm sure that's the same with you. But you're also doing a lot of good work in the community. It's a 3-pronged approach, I believe I saw, to helping the community. The Buffalo Black Nurses has logged over 20,000 hours of community service. You've mentored members who are in the program, get partnered up with other, I guess, more seasoned medical practitioners, and scholarship. You've provided over $18,000 in scholarship funds. That all correct?
That is all correct.
So you're doing some real tangible good in Buffalo.
Absolutely.
Come a long way in 4 years.
Mm-hmm.
What are those specific events and community outreach services look like?
We have some events that are on our calendar that we love to do every single year. So one of our favorites, we would stuff bags, Crown Royal bags, and we would stuff them. The velvet purple bag. And we would stuff those with toiletries and other goods. And initially when we started that particular fundraiser, we would give those to the military, the troops that were in need of those items. So last year, we changed it up a little bit, and we did it for Kaylee Cares. One of our members, she spent some time with the birth of her daughter in Children's Hospital, so she had her own personal experience with going through this birth, maybe experiencing some things that mothers go through after the immediate birth of a child, and she knew that this would have a positive impact on the mothers delivering at Children's Hospital, whether their child had medical issues at birth or special needs or whatever the case may be. But we were able to donate things, care packages, not only for the babies, but for the mothers as well. Journal items so they can journal and talk about their feelings, and blankets and socks and, things that women like. It's like comfort items.
Comforting, yeah.
It was it's absolutely amazing.
That's awesome.
That's just one. I mean, there's a list, but just to highlight some of the organizations we've been able to give back to, St. Luke's Mission of Mercy. This organization, I don't want to get the number wrong, but it's upwards to 1,000 meals that they give away a day.
Wow.
To people there on Sycamore Street. We were able to donate, I believe, 500 stuffed bags of just regular care items, toothbrushes, soap, socks, things like that to that organization. And that community was extremely grateful for it. And then partnering with other organizations that do work. Project Mona's House, they do work related to human trafficking.
Yep.
So the list goes on and on. But the work that we're doing, we want it to be organic. We want it to align with our mission.
Yep.
But we want the community to know that we're there and we're available. So let's have a conversation and see how we can collaborate.
Well, one thing I wanted to touch on, you have been there. The nurses have been there. They've been there through quite the tumultuous last few years. I want to highlight all the good, but I also want to get into the psyche, the lifestyle of medical practitioners, nurses, anyone in that field, in the healthcare field, because we went through a very tough time. And I say that the royal we, you all went through a much harder time. I can't imagine the emotional toll, the physical fatigue, and correct me if I'm wrong. Like there wasn't a huge bump in general average pay. It's frontline response workers, teachers, delivery personnel, all those sectors went through the pandemic without being able to kind of step aside like the rest of the population did.
Mm-hmm.
How was that for you? How was that for the group that you're a part of? How did you see your peers? How would you characterize those years? And really still ongoing, because we're saying we're past the pandemic, but we're seeing variants still popping up and a push for vaccinations still. So how was that era, that period of time for you and your peers?
The beginning of the pandemic was unlike anything I had ever seen, like most of us, unlike anything we've ever seen or lived through. It was a scary time. I was not working as a bedside nurse at the time because I've been in leadership for 5 years, but I still had to go and report to work every single day. And it's unfortunate because not only, I don't say, being a healthcare worker it has its dangers, right? Because you're exposed to blood and body fluids and all types of other situations that occur on the job. But having, it was the expectation for you to be there as we figure all this out of what this is. And there wasn't an immediate bump in pay. People lost their lives. They put their families at risk as they went home. So there were all of those challenges, not only with the fear of not knowing what this is, but, and I'm not going to be compensated because this is my role and you just expect me to be there. So I don't know if that, that absolutely wasn't the right approach to that. But it was traumatic, and we're still seeing the after effects. I just want to touch on the nursing shortage, because the nursing shortage is something that I learned about in my textbooks back in 2012 when I was working on my bachelor's degree. They said, we are at risk. We know that we're going to be faced with a nursing shortage, and this is what the number is going to look like. Nobody knew that COVID-19 would happen. So not only did the nursing shortage start to surface because of the baby boomers retiring and people, leaving the field, but then COVID-19 just enhanced it.
There's so many compounding factors there that just
unbelievable. So it's, number one, not an easy job. Yes, it's a great way to make a living. A great way, because you're a skilled worker.
Yeah, under normal circumstances.
Yes.
It's tough regardless, but add all these things.
It's tough regardless, but you add all these things to it, and now we're over here saying, hey, what about nursing? And everybody's like, I don't want to do that. COVID. I don't want to do that. There's no staff. It is back-breaking work.
Are you seeing the numbers still stagnant, or are
as far as people applying to... There's multiple issues, and I'm just going to be very real.
Yeah, please.
Nurses make a great salary, but why don't the instructors make a great salary? When I got my nursing degree, my associate's degree, I was a progressive student. I got the associates and the bachelor's I remember when I was working on my associate's degree, my instructor said to me, you're going to come out of school and make more money than I do. How is that fair? You need somebody that is going to be dedicated and fairly compensated to turn out quality nurses to this field.
It's just like teachers.
Exactly.
We need to pay well to have good teachers.
Absolutely.
Quality teachers. And then if it's not there, then why bother?
Exactly.
And I fear the brain drain. Like, just we're not getting the top individuals that we should be getting in these fields, in education and health, in any one of these that we touched on. And you said you were in a leadership position, so I'm sure the other component of it is the mental health component. You probably there was triage station. We saw all the pictures on the news, but you were living it.
Yes.
So how does one get through that? How do you help keep everyone on point, on the mission to continue doing your job?
It was a difficult time. You have to rely on a support system. And if that's at work, it's your coworkers, it's your peers. a good leader. So I was a clinical nurse manager. So I'm going to look to my directors and my president and everybody to just, what are you going to do to help improve our morale? Whether, you need to bring in someone from EAP and we sit and talk with a counselor or whatever the case. And then at home or, whatever your social circle is, someone that is willing to listen to how you're feeling.
Right. Because
as I had to teach my nurses, okay, this is the PPE that we're going to use. And this is, the patients didn't understand that our nurses were getting sick, and it's depleting the number of nurses that I have to take care of these patients. And guess who took the brunt of the anger? The leaders. So I'm getting yelled at, I'm getting screamed at, I'm getting called, you're not compassionate, you don't care, you don't understand. And I couldn't do anything but sit there and listen and try to find a resolve to the issue, something feasible that was going to satisfy their need at the time. Not be argumentative,
right,
but be compassionate and empathetic that they are in a situation and they need care. They don't care that I don't have a nurse. Find something.
It's everyone's going through this whole thing, and this is going to be a case study for many, many years after. But just seeing the general psychological effects that we all had, but that was part and parcel of it. I think that we forgot the human side of exchanges like that, and that you all in the medical field were having the same issues, but having to also help and deal and just go through it all and try to get us through it. So
definitely not a nice
I applaud
time.
you. No, and I'm sorry that I had to dig up
it's okay.
that period of time, but it's just, we kept going on. We kept moving on.
I don't ever want to experience anything like that again. I can remember getting up and driving to work, and this was during the times of the shutdowns.
Mm-hmm.
And it looked like a scene out of The Walking Dead because I'm the only car on the street. And I'm like, it was just eerie because there was such a stillness in the air.
And you mentioned being there for your peers and your colleagues. The Buffalo Black Nurses is, like I mentioned before, a big component is mentoring, partnering up with seasoned or experienced nurses and practitioners. Why should nurses join an organization like Buffalo Black Nurses?
Well, it's an excellent way to network. I think the most important thing is to share my own personal story. So like I mentioned a little earlier, I wanted to collaborate and just meet other Black nurses because I was one of few working in my organization. So, I was just looking for something more. And this organization has really fostered my development. I didn't seek out leadership in nursing. It just organically happened. But what gave me my confidence is we were doing a fundraiser one day. And we're out, and we're having this breakfast brunch, and we're raising money for our scholarship.
Threw a mic in your face, Tiffany.
Threw a mic in my face.
You need to MC this event. Here you go,
Tiffany. Get on the microphone, and then
you got voluntold.
Yes, voluntold. This is what you're doing, and I'm like, me, okay. And then from then on, I loved being on the microphone. The attention, and I'm like, okay, people are listening. So
right
this is the opportunity to say something that's meaningful and that has some relevance. And then from that point on, I had the opportunity to MC our galas. And so it went from having 20 people in the room to having, 80, 100, 200, now almost close to 500 attendees. And I had the opportunity, but if it weren't for that moment of somebody saying, you can do this, go do it. And it's important because we uplift one another. We pour into one another. You may not have somebody to talk to say, I really don't know what to do about this situation. There's probably someone in that room that has been through that situation, and they can help navigate your concerns and give you some great advice. And once I joined the organization, I saw the amount of success that was in that room, and that's what lit the fire for me to go back and get my master's degree.
It sometimes just takes that communal push and nudge to get that extra out of you. And it's great that you have this organization. It's great that you're not only helping the community but one another, because like I said, I think everyone needs it, but more so you all. I'm with Tiffany Anderson, the president of Buffalo Black Nurses. You're situated at Roswell Park, fantastic hospital. Now, let's talk about the patients. It's no secret. We've covered it in one way or another. Health disparities. It's something that we keep talking about. Systemically, it's an issue on the east side of Buffalo. And what are you seeing? What are you hearing? What are the blind spots that we're not addressing properly when it comes to our most needing population? Are they getting the proper knowledge? Are they getting the proper assistance? Are they getting into the field properly? You started Buffalo Black Nurses because representation, it matters. You need to say, hey, we're here and we're trying to get more.
Well, sometimes these kind of questions can spark uncomfortable realities. So it is important to have representation and diversity in healthcare. And whether you're a medical doctor, nurse practitioner, nurse, physical therapist, it is important to have diversity because studies have shown patients are going to respond in a more positive way when they have somebody that looks like them. And unfortunately, in this country, we still have racial issues. And whether people want to admit it or not, people of color are treated unfairly. Okay, so I just have to say that.
Yep. We welcome the uncomfortable in the conversation, so please continue.
So they're not treated equally. So naturally, a person, if I have to go to my doctor who is not African American, how do I trust that you're telling me the right thing, and you're looking out for my best interest? We know in humanity, that's what we should do, especially if we go into this field to take an oath that we're going to treat people fairly and, ethically. But there's a trust factor that is not there. So the importance of this organization and having representation is so we can have the best outcomes and the best health equity for everyone. And it's not just about Black people. Look at all of the refugees that are coming. We need diversity in healthcare in general. So this is not just about, African Americans. I've been a nurse for 16 years. And, you have to take these cultural courses because, Latinos respond one type of way, and then we have Bengali, and we have and we have to learn about all of these different cultures and understand how they react or respond to medicine and because of their cultural beliefs.
And you're sometimes the one that the people that are seeing the patients more than the actual doctors or specialists, and you're the first line.
We are the first line. And nurses, the instructors that instructed me, they would always say, it is so important to get your education. But to, some people, they may want to get their associates and stop there. But you really should continue your education because there's so much more to learn as you progress up that ladder. And nurses need to be allowed to work to the full scope of their license and a discipline. And yes, we are a separate discipline from a physician, but that is not for anybody to discount the work that the nurse does. Right. We have our own separate set of diagnoses. We have our own ways that we diagnose and treat, but that's all relevant information because we spend the most time with the patient. I'll never forget, I was a brand new nurse working at Millard Fillmore Gates Hospital when it was still standing, and I had an issue with the patient, and I called the doctor, and I presented the scenario, and he says to me, well, what do you think we should do? And I'm thinking to myself, well, you're getting paid.
You're the doctor. You spun it on you.
You're getting paid all these big bucks. And I said, okay. But that scenario stuck with me for many, many years. And that's why I advocate for nurses. And I said, don't let anyone ever say to you, you are just the nurse. You are worthy and you're extremely valuable and you are needed. Because if there were no nurses, who would do that work? Mm-hmm. Not the physician.
We're also, I'm sure, seeing a shortage of physicians and doctors and surgeons and the upper tier, I guess, quote unquote, of the medical profession. So yeah, more people are going to be doing a lot more work, and unfortunately, that means our nurses are going to be doing their job and then some. That's. I'm glad you shared that, because once again, another component of the many things that you all endure in your profession and currently in your field. Tiffany, we have a few more minutes here, but I wanted to ask you, as far as you mentioned the trust factor. We have a new vaccine rollout. Whatever you may think of that, that's for you to think. But do you find that there's an aversion still? Like, the Black community has had a very troubled relationship with a lot of different sectors, but with the medical field in particular. You look back at the Tuskegee experiment. You look back at, we just had on Henrietta Lacks. We had a guest, Pastor Nicholas, talking about Henrietta Lacks' family and all that happened there. Are you still seeing that? Is there still a reluctance to work with the medical practitioners? How can we fix that, if so?
Is in relation to receiving a vaccine?
No, I'm saying just in general, like just looking out for your health.
You increase the diversity. That is a simple fix. Who better to relate to someone than, it should be a mixed bag. Our country is a mixed bag. And that's what makes us unique, and our differences make us better, actually. But if you don't have diversity in your hospitals and your doctor's offices, why would I want to go there? Some of us, unfortunately, are used to being the only ones. I sit in boardrooms, and I'm the only African American there. I don't need anyone to point it out, because I can clearly, Stevie Wonder can see it. Right? But I had someone point that out, and I'm like, well, that was really unnecessary, because we all know this.
I'm a nurse. I'm a Black nurse.
Yes.
But I'm a nurse
But
first.
I am a nurse. And if there's not more people and multiple colors in this room, well, then shame on you. You need to do a better job. And the way that we improve people to go to the doctor and to understand what's going on with their health before it balloons out of control, and then we're putting a strain on our economy because a lot of people are receiving Medicare benefits or whatever the case. That's a whole nother story.
It's another episode.
That's another episode. Let's improve the diversity. We need more students of color going to school and enrolling in these nursing programs, but we don't need to set them up for failure. We need to set them up for success. And students joining the organization and linking up with mentors to help them successfully get through nursing school and pass it in NCLEX, that is one of the layers to what we're doing with this organization. But you need to increase diversity in physicians' offices and healthcare organizations. Absolutely.
And what would be the biggest concern for nurses, medical practitioners in Western New York? What's the pressing matters on the minds of nurses right now?
For me, being in leadership, I'm looking like, I'm at the point where I'm looking at policy and,
Is retention a concern?
Absolutely. And retention has been a concern since COVID, because here we kind of mentioned, we talked about this briefly before, when you start offering contract dollars, and if a nurse has the flexibility with her family to go and work on a contract, then the organization here is losing out. So then they got to copy what the other organizations are doing and bring in contract workers. But now you're creating a divide with the staff nurses of the hospital working alongside somebody with a contract, and you're getting double what I'm making. So
is there, it's I would like to think everyone's all hunky-dory and working together, but it's
not the case.
It's not the case.
It's not the case.
This is an outsider that's coming in taking a job. A job that should be filled internally and locally,
Absolutely.
But it's not. Contract nursing is something that I have a friend who was a wife who's also in the medical field, and she took a pretty lucrative position for a 3-4 month stint on the West Coast. And I was like, well, that's a thing apparently. And sure enough, that's going on in a lot of big cities. We're part of that concern of trying to retain and also just get folks is keeping them.
It's not sustainable. So now here's my business side kicking in. I'll be done with my MBA in 3 months, by the way.
Yeah,
but there's
congrats.
my business side kicking in, right? So it's not sustainable for an organization. So the leaders need to come back to the drawing board and let's get in this room and figure out, not just for healthcare, but any sector. How are we going to invest in our staff? Because me paying thousands of dollars for contract work, it's not good for our finances. We're going to take a hit. And not to mention some of the value-based care things that we need to be related to have good health outcomes, so we don't pay the government a penalty. So you see how all of this ties together? So if we have diversity, then we can improve some of our health outcomes, not pay a penalty here. I mean, it's a lot.
It's a lot to unpack.
It's a lot to unpack and fix. But I went into that because it is important for organizations to figure out, how do I coach up and develop the staff that I have? If you have money to go and pay somebody on contract, then you have money for staff development. Let me retain the people that I have here, and those that are hungry and motivated and willing to learn more, go back to school for a degree. Let me invest in those type of programs, and those people will stay, and they'll be happy.
And Tiffany, once again, Buffalo Black Nurses, if you are in the medical field, if you want to help, how can folks get more information about what the group is doing?
So we have a website, buffaloblacknurses.org, and it has, let's say an organization wants to have a partnership with us. We have a community service request form, and they can fill that out, and that'll give us an opportunity to review it and make sure that it falls in line with something that we can do and provide. We ask for a time period turnaround because we're number one nonprofit. None of us get paid for any of this. Our nurses are shift workers, so we can find volunteers, but we want to make sure we give them adequate notice to be able to attend an event, what may be needed. So we do ask people, just to fill out that form to request, and we'll be glad to review it and have one of our board members reach out. If you are a nurse or a student that's interested in the organization, there is also information on that website on how to join. Very affordable membership fee. We wanted to keep it lower than what other nursing organizations charge for their membership. So that information is there as well.
And you got a gala coming up, right? You mentioned the gala that you MC. It's coming up in November, correct?
Yes, I'm no longer the MC. If you weren't there, you missed it.
Someone else now.
If you weren't there, you missed it. It was a great time, but I did do it a few years in a row. But yes, our annual nursing scholarship gala is our largest fundraiser. We work all year, and this is like the highlights of it, right? It's at the Niagara Falls Convention Center, November 4th, 2023, and it is an amazing event. You'll have it's black tie. You have to wear all black. It's black tie. It's an amazing sit-down dinner, dessert, but it's not your typical gala. We have a great time at this gala. So one of the primary purposes of this is to honor our nurses that are currently enrolled in school, those that have graduated. So the ones that applied for the scholarship, they don't know how much they're going to get, but they'll be awarded with their scholarship at that time. And then we highlight our graduates from the previous school year. So that's a really special time for them. And then this year, we're going to put a little bit of a spin on it. We want to highlight the members of our organization that have become nurse entrepreneurs. So nursing is an amazing field, but there is also things you can do beyond the bedside that you can use your nursing license for. So
what does some of that look like?
Well, we have one of our nurses, she opened just like a spa aesthetic type of business. And so you can go and get, spa treatments, Botox injections, these type of things. So there's a lot of different things you can do when you're creative and innovative. And
how you have the time outside of
they find
nursing is beyond me. I'm just here trying to make it through the day.
They find it.
As a parent of two and a producer for a show, I can't imagine how you all do it. So kudos to you. And Tiffany, many, many thanks to you and your group and just nurses in general, because I think the media and everyone really publicize that. But me personally, whenever I run into somebody that has gone through what you all have gone through and continue to do so on a daily basis, I thank you. It's a tough job, and I'm glad that you are all doing it. So thank you very much.
It is truly, truly our pleasure. And we just want to attract people that have that same passion that we do because we absolutely love being nurses, and it is an honor to be a nurse. Absolutely.
It's been an honor to have you on
Thank
What's
you so
Next,
much.
Tiffany Anderson. Thank you for joining us, and we've got more of What's Next after this.
You're listening to What's Next, our place to discuss the important issues of our communities of Western New York and Southern Ontario. We want to hear from you. Click on the Talk to Us option in the WBFO app, and we will work to get your questions or comments on the air. Do you have a story or concern that we should be addressing? Email us using whatsnext@wbfo.org. Together, we'll have the conversations that are needed. This is WBFO, your NPR station.
We've taken some auditory field trips on our show, but today we're just going to talk about the concept of field trips and the necessity of getting out of the classroom and learning in our outdoors, learning about the world out in the world. And to do so, I am speaking with the executive director and founder of Get Out and About, Britney Upshaw. Britney, thank you so much for joining us on What's Next.
Thank you for having me. I'm really honored to be here.
And Britney, you are, as I mentioned, the mastermind behind Get Out and About. And just I'll give the quick elevator pitch of it, and then you can give me the rest of it. But the big concern here is making it possible so that students don't miss out on that experience of an off-campus field trip that are unfortunately subject to financial constraints both in their households or the school district itself. I think everyone can look back at back in their childhood, parents and adults alike, and those were the best days to look forward to at school. I mean, you should look forward to all days at school, but let's be honest, when you got out of the classroom and got to do something special, that was something you look forward to. Mm-hmm. If you forgot the permission slip to get it signed, that was a huge bummer. But please explain the mission of Get Out and About and how that came to be.
Yeah. So I was inspired to start Get Out and About by doing a pitch night at UB. I pitched the idea, just like offering field trips to those who couldn't afford it. Just like having that enriching experience of a field trip, because a lot of people don't have that experience. A lot of kids don't get to go to those things in their own individual households. So just like helping schools and organizations that may host field trips to sponsor students to attend those field trips for their educational and recreational benefit. I was inspired because I did a pitch at UB. And after I asked a question, I said, who knew a kid who couldn't go on a field trip because their parents couldn't afford just the extra fee that the schools charge? And every single person raised their hand. After I did the pitch, people were coming up to me saying I was that kid. People were saying I was an immigrant family. My parents could not afford the extra fee. And people were saying my mom had 6 kids. She couldn't afford to send all of us, so she didn't send any of us because she didn't want anybody to feel left out.
Right.
So it's a really big issue, unfortunately, like in our city today.
I was just mentioning that it's sad when you don't have their permission slip signed, but if that was only it. There's a real concern here that even for a child that has siblings, a child that practically just you can't afford that pass to go to the museum, the science museum, to go anywhere, you're also isolating that child more by doing so. That's something that we should be avoiding at all costs, I think. I wanted to have you on here because I think that we take that for granted.
We do,
We think that the public school system or schools in general have that baked into their budgets, but you mentioned it. There's passes, there's fees that are associated to almost each and all field trips. I don't want to say the I word that's floating around out there, but I'm pretty sure given all the stressors, the economic factors that we're seeing, just rising prices and unfortunately just household wages stagnating, that's got to be a big component in this, right?
Definitely.
On top of we had already a population that couldn't afford it already, but now there's probably a greater amount now, correct?
Yes, definitely. I spoke with the executive director of Delvin Grider Community Center, and they said they used to do field trips, pretty frequently. And ever since the rise of COVID, like with COVID and rising prices, she said that buses are 3 times what they used to be. I spoke with a teacher, and she was telling me that schools are only doing walking field trips in certain districts because they can't afford the cost of the busing.
Right.
Or like teachers are covering some of those students' costs who can't afford the extra fee. And teachers, they go through so much already.
They don't make enough as is. I have a family member who's a 3rd grade teacher, and the amount of money that comes out of pocket for materials for those in those cases where the student needs a pair of scissors or what have you, that's coming out of, unfortunately, their pocket.
Yeah.
And I didn't even associate that as well. Field trip costs, like that's it's sad to hear that this is that it affects not only just the students but the teachers as well in a way. You mentioned the buses. We have a bus driver shortage. I assume that's also one of these factors that's getting lumped into the cost.
Yeah, it's a huge factor in the rising costs of the buses.
And is this mainly, I mean, I remember grade school being the bulk of the field trips, but middle school as well, high school somewhat, but those are real pivotal years. Those are pivotal grades, the grade school years and then early middle school. We want to give our students a comprehensive education, and that means sometimes and a multifaceted education plan. That means getting out of the books and actually seeing things in person.
Right. You want kids to experience those hands-on, connecting the dots from what they're learning in school and seeing it in the real world.
Is it also, have you partnered with any field trip destinations or locations here in the Western New York area?
Yeah, so we're working on a partnership right now with Gloria J. Community Center on Main Street. We're working with them to send them to Parkside Candies. It's our first field trip actually since we just started in May. We're sending the kids over just to have a fun social outing for them, because social experience and social emotional goals are also part of our mission. We want kids to have those fun social outings too, so they get recreational benefits from that as well.
Pairing up with somebody and all right, let's go at least in my field trips we would sometimes get the free range portion of it where you can kind of just go and explore on your own and just pairing up with friends and choosing your own adventure. That's we don't think about it, but there's a learning experience there.
Yeah.
The social aspect of it and component is, I think, something that we forget about these things. And I'm glad that your organization Get Out and About is raising the awareness on this because, we are so caught up in other concerns in our mundane lives that we forget about how important even this is for a student.
Exactly.
Now, I didn't grow up here. I'm getting acclimated with the Western New York area, but one thing I remember is hearing the locations, the weather. Unfortunately, we are a tundra when it comes to winter time. I'm still not used to that, but I got to imagine that also limits or makes educators have to be a little bit more creative in the destinations that they choose and where they can go. When you can't really go out to an outdoor venue, you have to get creative. Are you seeing that also playing a role in this?
Yeah, we're definitely thinking of just different ways to get kids out and about, during those winter months when it's just too cold. We're thinking of places like Community Music School is where I work. They said that they would be a host for field trips for schools in the area. I know Buffalo Science Museum and Explore More downtown as well. Just, places that they could go possibly during the winter time too.
And you brought up Community Music School. We're discussing the field trips, but and Get Out and About. But you've been finishing up your MBA. You've been working at Community Music School. What is the mission of Community Music School, and how has that, framed how you've approached this initiative?
Community Music School's mission is just to make music less elitist. For a very long time, the music world has been very elitist.
Something else that has a high pay-to-play threshold.
Definitely.
Literally, you have to. Musical equipment is not cheap.
No, not at all.
And that's another one that's struggling. Arts and music in schools.
Yeah, we just want to make it more equitable. Just like you said, that's a very high pay-to-play price for music. So they discount music lessons according to financial income. We moved to the East Side 2 years ago to reach more people, and it's just been great since we've come there. We've gotten a lot. Our diversity has grown. We used to be a part of the Elmwood Village. And we've just seen diversity grow, and we've seen people play music together. Music unites us all. So it's been a very beautiful experience to watch.
So I was asking my colleagues and trying to get a sense of the locations that were popular when they were growing up. You mentioned Explore More, a fantastic spot. Tiff Farms.
Yes.
The Science Museum, Art Park. What was your experience with field trips? How did they mold you, and what was your favorite one?
I would say my favorite field trip was when I did summer camp at UB Step, and we went to Darien Lake because we were learning about engineering and we were learning about machines, and they took us to Darien Lake and they told us how roller coasters work beforehand. And
that's an interesting way of having that field trip.
Right?
I'm sure the teachers are like, all right, we need to get out. We need to get them out and burn off some energy. Let's go to Darien Lake, but we got to have an educational spin, and that's I wouldn't have thought of that one. That's brilliant.
Yeah, it was super creative. We got to make a little song beforehand about machines, and it was so fun. I had a great time with all my friends.
and once again, just getting out of the classroom, we've got a lot of new ways to reach our children. I remember our school ended up having it was a big day when we got like smart boards, and now that's almost in a lot of schools. It's almost in a lot of that I've seen. It's still now almost like it's expected. Kids have tablets. For the most part, we're trying to get everyone situated with the upcoming technological world.
Exactly.
Which just opens up a whole new plethora of teaching opportunities. But why is it so important to get out and about?
Yeah.
Sorry for making it that cheesy of a segue.
No, I love that.
why do we need to focus on that?
Yeah, just like you said, with the rise of technology, and kids are visual learners. I mean, a bulk of children are visual learners. They need to see what they've been learning just in the real world. There's so many benefits to field trips. There's obviously educational benefits, like we discussed, just going to the science museum, seeing the planets, seeing what they look like, all the cool features that they have in that exhibit. And there's also kids who experience field trips typically have higher GPAs than kids who do not. They have increased enjoyment of learning, which we really do want kids to enjoy school. We want them to enjoy learning. There's a lot of studies that suggest that students who go on field trips is directly linked to a bond with your community. And those students that don't have the financial necessities to go out and about, in their own free time with their families, they need to experience the community. And we want them to experience Western New York. We want them to love their city, to love where they're from, and just have that bond with where they're from.
89% of the amount of students that went to field trips, it made them more curious and involved in the world around them. I got to imagine that. I remember back home we went to the Wonder Bread factory. We had a Wonder Bread factory down South Florida, and I got to imagine like this might make a baker out of somebody someday, or just get somebody thinking differently along those lines. For me, the big field trip was always the planetarium.
Oh, that's really cool.
And I know we have one at the Science Museum, but just seeing the night sky, learning about it, different than in a textbook, different than a film or a movie. It's just another way, as you mentioned, of learning something and taking it in and getting inspired.
Exactly.
At the end of the day, I think that's the big thing about field trips and getting out of the classroom is just seeing that there's a real world application to the stuff that you're learning. Right?
Exactly. Seeing it in real life in real time is just so much more like beneficial sometimes for kids, especially when they're visual learners. Helps them build critical thinking skills. They get to learn, all about the world around them.
Brittany, if anyone wants more information on what Get Out and About is doing, if they want to get out and be about it, what can they do?
They can head to our website at getoutlandabout.org, learn more about our cause and what we do here.
Britney Upshaw, thank you so much for joining us on What's Next. I appreciate it.
Thank you so much for having me. This was awesome.
Then thank you for listening to us on WBFO and WBFO HD1 Buffalo, WOLN Olean, and WUBJ Jamestown, your NPR station.